Let's start. Would you please explain to us how a psychologist provides care to patients and their caregivers, and how your role kind of fits in with the overall care that a patient receives here at Siteman?
Well, I think a psychologist's role in a cancer center is very important. Patients come to Siteman receiving world-class medical care, so we want to be able to offer the same type of supportive care to our patients. I work with a team of psychologists and trainees, so doctoral students who are learning this field and becoming experts as well. We all specialize in cancer, so we're able to offer things to patients just to help them along the way. We know that mental health and physical health are really related, so we want to be able to bring that piece to our patients.
Excellent. And Rabbi, let's again welcome Rabbi Glestein. Rabbi, you too are here to serve people with cancer. So with that, how have you been able to work with cancer patients? And can you tell us about what you do to help patients?
Yeah, I mean, presence really is an art. And as part of my introduction to people, I always tell them that I'm here to be supportive on a person-to-person level, on a human level. So that kind of just breaks the ice a little bit. I'm not here to share any bad news. I don't have any insider information. I'm really just here, and it's about the being, not the doing. And I love the saying that goes, don't just sit there but do nothing. Yeah. Really, and patients know when you're fully there, present for them. So I try to really step into a person's world with humility, with awe, with wonder, and a listening heart mostly. And along that way, when people coming in to kind of document their values and reaffirm what they still have going for them, which I believe is a soul, kind of that spark within.
Right. Very good. Are there any misconceptions about the counseling that you provide as a chaplain?
It's difficult to put your arms around what spiritual care really is, I think, for a lot of people, even for us. So people are just not sure often what it means, what chaplaincy is about. And that's why I said it's really about walking alongside people at a time that's very trying. And the misconception probably is that it's strictly about prayer. Right. About religion. And that's why, again, I introduce myself more of in a human way. And I think people appreciate that and value that you're just there for nothing more than to again, walk alongside them.
Right. What type of services do you offer to patients and families? Are they specific to each type of cancer? So maybe I can direct that to you, Dr. Vanderlan.
We offer therapeutic services to patients and their families. So we see patients of Siteman, we see their caregivers, their loved ones, their spouses, adult children, any caregiver really. The goal is to help them through this in any way that they need, really. So we offer individual therapy, we offer group counseling, which is really beneficial. We're at the satellite centers as well, seeing patients. We see patients on the inpatient floors. When they're here for sometimes very long stays. Yes. We also see patients in the integrated care clinics, so in their medical clinics with their providers. That's usually a pretty short-term intervention, something they can probably walk out the door with to help them right away. The group therapy or individual therapy usually is about 10 sessions, and we can walk them through those goals that we talked about.
Very nice. And Rabbi, to that question to you as well, the services that you all provide?
Well, we have a whole cadre of chaplains. So if someone specifically would like a particular denomination, we're usually able to answer that. There is Mass offered, which is open every day of the week at the various chapels we have on each side of campus. And so we're there to really be with people.
Excellent. So I think it goes to the next question that I had. It was in regards to Jen asked, how do I request a chaplain to speak while I'm receiving treatment? And she also asked, is there a chaplain I could go to?
Yeah, so during admission, patients are asked a whole slew of questions. And one of them is, would you like spiritual care? If it slips through, then it's really just as simple as asking your nurse.
Okay.
And we get those, and we prioritize those requests. So the person will be seen. It might just be for someone to listen to them, or it might be for prayer, but we're on it.